For today's EM and FEB, we're going to talk about discharge instructions. And this is such an important part of the ER visit. It gives closure, it gives the patient a plan for when they go home, and it's also just good patient safety as we're sending them back out of our care. So why do we need to get better at discharge instructions? About 75% of people interviewed said that they don't understand a key component of their discharge instructions. And of those, many didn't even realize that they had a poor understanding. They thought that they had the right directions, and that's even more dangerous. So there are 5 parts to the discharge instructions that I want you to remember every time you discharge a patient. It's the diagnosis, visit summary, home care plan, follow-up, and return. So first off, let's talk about the diagnosis. So this is pretty easy, but one thing to remember is that you need to be specific only if you know for sure what the diagnosis is. So it's not just your best guess. For example, don't put down viral gastroenteritis if you're not quite sure that that's what they have. You need to be a little more general. Put down vomiting and diarrhea. Same thing, if you have a rapid strep, sure, go ahead, put strep throat. Otherwise, if you're waiting for a culture, you just need to put pharyngitis. So next up is the visit summary. This is where you get to tell them what happened in the ER, what their results were. This is both a reminder for the patient, maybe an interested family member, and can also be read in a follow-up visit by a physician to see what happened in the ER. So for example, you can say you are seen today for chest pain, give them the results of their x-ray and their EKG and blood tests, and lastly, explain what the medications were for that they were given while in the ER. Next, we have our home care plan. This is a really important part. This is where you're going to tell them what to do at home, what medications they should take, and what to expect for the progression of their illness. So, for example, for an ankle sprain, first you're going to tell them ACE-RAP, Elevate, ICE, then explain what medications they should take, and lastly, what to expect for the course of the illness. They're going to have a lot of bruising and swelling, and should maybe start feeling better in about a week. Okay, next step is follow-up. This is where you're going to tell them who to see and when. This can vary quite a bit. For example, in an abscess or a cellulitis, you might be telling them to come back in 48 hours to the ER for a recheck. If they had some abdominal pain that's now gone and they're feeling very well, you could tell them to maybe give their primary care doctor a call in a few days if the symptoms return or if they're concerned about anything. For someone that needs a specialist, make sure and tell them, for example, vaginal bleeding, that they should call their gynecologist. Again, give them a timeline in about a week. Lastly, we have the return instructions. And this I could think of in kind of 2 subsets. So first you have something specific for their visit, and then also some general return instructions. In the general instructions, you're basically going to say, seek medical care, return to the ER. If you have any new symptoms, if you're concerned about them. And then I would give them a little list so that they know what are the newer concerning symptoms. In the specific area you're thinking through, say you have a patient with a head injury, you're about to discharge them. Think to yourself, what do I want them to come back here for? What am I concerned about? What are the possible complications? What are the symptoms of those complications that the patient should be aware of? So for a head injury, think about if they have worsening headaches, if they pass out, they continue to have vomiting, and then any neuro deficits, spell that out for them. Any changes in their vision, difficulty moving, speaking, or being less alert. So one of the biggest pitfalls to our discharge instructions is comprehension. We can give the instructions, but if our patients are not understanding them, that's just as bad. So of the 5 categories, the home care plan and return for instructions are what confuse our patients the most. So why do they have low comprehension? One of the biggest things is language barriers. This is huge. Make sure you have a translator that's available while you're doing your discharge, and if it's possible to actually have the instructions in their language, that's even better. Next, we need to just make sure our instructions are readable and understandable. So we need to use simple words. Remember, most of our patients are at around a 6th grade reading level. Make sure you're not using any medical jargon and no abbreviations. So here's 2 examples of some chest pain discharge instructions. This is for the visit summary. So again, don't use medical jargon and no abbreviations. Make sure and talk about these in a way that the patient can understand if they're reading it or if a family member is reading it. Lastly, remember that less is more. It's really tempting to print off those abdominal pain 8-page patient education sheets, but have you ever read that all the way through? Probably not, and your patient's not going to either. The chances are it's also just not very specific for your patient's problem, and it's not going to be very helpful to them. Or it's going to give them kind of erroneous information, and they're going to come back to the ER for the wrong reason. So what are some areas we can improve upon? First of all, the delivery. So in order to make our message stick, make sure you tell them verbally what the instructions are in addition to giving them the paper printout. Use a translator as needed. Also, if you're concerned, go back and tell them twice what to return for. Have the nurse do it, and then also give them a sheet. The more times you tell them, the better it's going to stick. You can also check for comprehension by asking them give them a little quiz. Well, what day are you going to come back for? When's your follow-up visit? What symptoms are bad that you should come back for? And also try to just give them some assistance with follow-up appointments, or connect them to a care program if they have a chronic illness. So for this talk, remember for your discharge instructions, there's 5 parts you need to include every time. Your diagnosis, your visit summary, home care plan, that includes what to do as well as medications they should take, who they should follow up with, and then the return if section, which should include specific things for their problem as well as a general summary. And just remember a couple of the pitfalls. Make sure it's at a 6th grade reading level, no medical jargon, less is more, and give verbal instructions. The more you say it, the more it's going to stick. Thanks for joining us on EM in 5.